Here to discuss, MS Now medical contributor Dr. Vin Gupta. Doctor, thanks for talking to us. How concerned should the general public be about this flu strain?
Well, Laura, they should be concerned because flu, and as I've seen throughout the course of my career as a pulmonologist, flu is very unpredictable. You can't just assume because, say, you're younger and don't have pre-existing medical conditions that you are safe and therefore can avoid the vaccine. That is not an equation that makes any sense based on what we've seen. Those of us that have seen this virus know it's unpredictable, know it can impact anybody. And that's exactly what we're seeing in hospitals across the country right now. We're seeing places like California, you mentioned the Carolinas, taking steps to make sure that their hospitals are safe. In places like California, we're seeing increases in flu activity in wastewater, which has now become a phenomenon to look at infectious diseases. Laura, are we seeing evidence of infectious diseases in wastewater? We are in places like San Francisco, Orange County, other parts of the country, New York City. We just had a spike, schools closing down. So this is serious, and especially because this version of flu looks to be even more contagious than prior years.
Do you expect that more hospitals are going to restrict visitors?
I could see this being a strategy because for everybody watching, flu, usually we think the second you get flu, you can have a high fever, you're going to feel very ill with flu-like symptoms laying up in bed. There's actually a prodrome, Laura, where you get exposed and there's about a 48-hour, 72-hour incubation period where you may be contagious but not actually symptomatic. And that's what's happening here. Hospitals are saying kids are getting exposed because of the holidays, because of being in a school-like setting. They may not know they have the flu until they're symptomatic. There's that incubation period. So let's take extra precautions to protect older adults, especially. Yes, I think this makes sense. Also, just for everybody out there, if you're feeling ill, there's now easy access to tests that you can just get online for COVID and flu, since the symptom profiles overlap. But you can test yourself, one, and then two, if you're sick, stay at home, both for yourself and then also for the general public and their safety.
So it sounds like one day out from New Year's celebrations, you're advising people to stay home if they're not feeling well, but also to use the tests that are readily available to them. According to the CDC, though, fewer Americans got the flu shot this season compared to last year. Is that having an impact on the rise in cases?
No, assuredly. The fact we have a society really in every zip code that is not optimally protected. And this goes back to the fact that flu is unpredictable. We have leaders at the federal level that are constantly pouring cold water on the concept of vaccination. And so it's not surprising that we are so vulnerable, especially with a mutating virus that's more contagious. I'll just also emphasize here, since I think this doesn't get talked enough about, if you've been exposed and say you're not vaccinated, what can you do? You can still get vaccinated, but you have to wait until you've recovered from your illness. And say if you've tested and you're positive for flu, get that test. If you have flu-like symptoms, high fever, if you have body aches, upper respiratory symptoms, get tested for flu, get tested for COVID, especially if you're medically higher risk, but really anybody here. And why does that matter, Laura? There's a great treatment for flu called Tamiflu that works best within the first 48 hours. That's the golden window of therapy. Enough people don't actually get tested enough on time. So important to bring either attention to your medical provider or get one of those at-home flu tests to make sure you get tested and then treated if you're positive.